When early diagnosis means better outcomes, finding undiagnosed patients is everything. But when the disease is extremely rare, about 1 in 160,000 rare, the job is not easy. So where do you start? By figuring out where to look. Hunter syndrome is a genetic disorder afflicting boys. Patient demographics don't impact who's affected, so patients should be evenly spread throughout the population. But when we dug into the data, there were gaps in parts of the South. Why? These were predominantly Hispanic areas, and we knew there had to be a connection. This led to our first insight. Language, culture, the likelihood of having health insurance, maybe even residency status must be affecting their healthcare decisions, and therefore rates of diagnosis. So a campaign to target these areas started to take shape. With symptoms that can be mistaken for typical childhood ailments, but together cause developmental delay, the goal was to get moms to ask, is he falling behind? This led to our second insight, that parents were already doing something that could help tell the story: growth charts. It all came together with A Mom Just Knows, a campaign that used a homemade growth chart to illustrate missed milestones while encouraging mothers to trust their instincts. Understanding our audience's lifestyle and knowing that they likely own smartphones but not computers, we used billboards, transit, posters in neighborhood bodegas, and geo-targeted banners to drive to a website where visitors could download a mobile-friendly infographic. The infographic had 3 goals. First, reassure parents. Second, educate them about the disease. And finally, help them talk to their doctor. So how did it work? In just 1 month in 2 test markets, we drove almost 1,600 people to the website to learn about Hunter syndrome. And although we haven't confirmed any new patients yet, the campaign was so successful, it's going to be expanded into other markets.